I have Dr. John Fantauzzi on with us, and he's a board certified radiologist. And do cats really lower your blood pressure? Pets really do that?
Sure can.
Yeah. So, would you like one?
Oh.
No, that's okay. We're talking about something entirely different. We're talking about having a test done through a CT scan to find out if perhaps you might have a lesion, or tell us more about that so people might be
Sure.
more attuned to what is available to them.
Certainly. In the last couple of years, the National Lung Screening Trial published its data that showed a 20% mortality reduction as a result of early screening with CT for lung cancer in a population of patients that are at higher risk for lung cancer, basically older smokers and former smokers.
How about secondhand smoke? People who've lived with a smoker, would they be?
Not, according to the strict criteria, no. They would not be candidates for the scan. But certainly secondhand smoke does increase your risk for development of lung cancer.
Okay, good.
So the criteria are 55 to 74-year-old smokers and former smokers who've smoked at least 30 pack years. What that means is you take the number of years that you smoked and you multiply that by the number of packs a day that you smoked, and that comes up with your pack years.
Oh my gosh.
So 30 pack years who have smoked actively in the last 15 years and who have not been sick enough in the last 18 months to need a CT scan of their chest.
And this test is something they would do on their own, is that correct?
Well, yes and no. We are not accepting patients just walking into the office and asking for a CT scan. We really want to partner with people's primary physicians.
Okay.
So,
do they have to be part of community care? Or?
They do not.
Okay.
We do require that the patient have a prescription or a request from a doctor for the exam, because we think it's very important that patients talk to their doctor about their risk factors for lung cancer, whether the exam is right for them, and what other things that lifestyle changes they might need to make to reduce their overall risk.
What makes this test different than if I go to a physician and he says, I don't know, I see a shadow on your lungs and I think you need to have a CAT scan or a CT scan?
To the patient, very little is going to be different. It's going to be a very quick and easy scan. You'd lie on the table like you would for any other CAT scan. You'll be in and out of the office in about 10 minutes.
Oh, is that fast?
It's that fast.
So there's no injections or anything?
There's no injection. The difference is really to the radiologist. We're using very little radiation compared to what are called true diagnostic CT scans or older CT scans. As the technology has gotten better and as our comfort with reading for lung cancer has gotten greater, we're down to very, very low radiation dose. For the radiologist, that means that the image is a little bit, we call it noisier, but it doesn't affect in any way our ability to diagnose.
Is that like a PET scan where you have that thumping sound?
No, there's no thumping sound.
No thumping, okay.
No, it's just in and out of a donut.
Okay, all right. Now, when they have this test, they're in and out, they don't have to prepare for it or anything?
Nope.
Okay, that's simple.
Oh yeah, it's you come in with your request and you'll be on and off the table in about 10 minutes. It can be done, the actual scan itself, once it's set up, can be done in a matter of seconds.
Now, are these, I know when I went in for my mammogram, they say, well, we're not using the heavy radiation now, we're using digital, and there is radiation, of course, with that. But this less. Is this the same type of thing? Is it digitalized, or is it? Well,
it's completely filmless.
Okay.
We read entirely off of computers.
Oh, okay.
To give you a sense of the radiation that we're dealing with, one of these scans is about background radiation just from living in Albany, Schenectady, New York for about a year.
Oh, okay.
So it's really quite low.
Yeah, and of course we are exposed to a lot of radiation in our lives, as you know, you're a radiologist. Whether you're in a plane or you're, just ambient radiation, I guess you'd call it like that, you go to the dentist, there's a lot of radiation. Is there a maximum amount of radiation that we can have in a lifetime? I know people who have radiation treatment that sometimes I hear, well, you've had all you can have. How does that work?
Well, there's two types of risk of radiation, generally speaking. There are certain levels of radiation that have deterministic effects. That means that that, like for instance, cataracts will develop after a certain amount of radiation. Mm-hmm. And then there's what's called random or stochastic effects. And that just means that theoretically your risk for developing malignancy increases with increasing exposure to radiation. But there's not exactly a direct correlation.
Okay.
we do everything we can do medically to minimize the amount of radiation patients receive.
One of the things that you are thoracic is your specialty. Is there any advice that you can give to our viewers to reduce the risk of lung cancer?
If you smoke, stop now.
Right now.
Now, that would be number one.
And you can go to New York Quits to find out how to do that.
Absolutely,
right? Yeah.
absolutely. I think that would be number 1, 2, and 3 on the list.
Yeah.
If you live with a smoker, encourage that smoker to quit.
Or smoke outside,
Or
maybe?
smoke outside.
Get away from it. I see women with babies that have a cigarette in their mouth. Is there an effect on the kids? It always makes me nervous when I see that.
Well, it's certainly not good for a kid to be exposed to, just like it's not good for an adult to be exposed to cigarette smoke. Children of smokers, children who are exposed to cigarette smoke, do have higher rates of asthma and upper respiratory infections.
Right. Asbestos, how does that affect, I know you can get lung cancer, mesothelioma from the asbestos. Do you see many cases like that?
Not so many. Fewer than we used to several years ago, for sure.
Because we're getting rid of the asbestos.
We're getting a lot better at getting rid of asbestos in ways that are safer to asbestos workers.
So we talk about lung cancer with cigarette smoke, asbestos. Are there any other factors that would...
Genetic.
Just genetic, okay. And genetically, if you have a parent that had lung cancer, even if you are not a smoker, you still have a predisposition for that?
Your risk is higher than the person whose parent didn't have lung cancer.
Okay, so it would be good to check it out. Where can they get these the scan?
Sure, it's at ImageCare Medical Imaging, which is part of Community Care Physicians. We're on Troy-Schenectady Road, 711 Troy-Schenectady Road in the Capital District Health Park in Latham, right off of Exit 6 of the Northway.
Right, and what is the wait time on that?
There really is no specific wait time. We can get you in the next available appointment, provided that you have a prescription for it.
You need a prescription for it. It's something you might want to, if you think there's a risk factor in your family, discuss it with your primary care physician, and perhaps this might be just the test that will save your life.
Sure. And I brought along a couple of images if you'd like to look at them.
Let's do that.
Sure. So this first image that you're looking at, the yellow circle is encircling a very small lung cancer. That would be the lung cancer we hope to see on the screening test, because that is something that we could watch, see if it grows, see if it's causing trouble, and take out with relative ease. The next image shows the encircled lesion is slightly more advanced. This would probably maybe be watched for one scan. If it didn't go away, this could be removed.
You mean they could go away?
Oh, the vast majority of the findings on the CT scans that we'll be looking at
lesions that will
are
just
benign.
Okay.
Many will go away, many will never change.
Okay. But at least you have a record.
Oh, absolutely.
Yeah, of that.
This next lesion that's encircled is a bit more advanced. This is clearly cancerous. And this patient had several scans prior to this that demonstrated growth. This is also fairly easily resectable for a thoracic surgeon. And this last image, the next image, unfortunately, this is what we hope not to see. This is what we're trying to prevent. This is a very large advanced cancer, and this is going to be very challenging to manage.
Now, what would the symptoms be for that person who has that cancer?
Can run the spectrum from a cough. Cough is very common. Patients can develop shortness of breath.
I mean, how could it get that far that they hadn't checked?
You'd be surprised. Sometimes the development is so slow and so insidious that you don't notice change day to day, and never.
And it's a cough, and you say, it's a smoker's cough. It's been around a while.
And sometimes people don't want to know.
Yeah. Isn't that the truth? Yeah. If I don't check, then I won't know, and then I got another day of feeling really good.
But exactly the good news is this is very preventable. Mm-hmm. You can prevent lung cancer by not smoking. If you are at higher risk, we can find the lesions very early on and treat them before they become bigger problems.
I hear that this is the most preventable cancer.
Lung cancer is a 20th century Western world phenomenon.
Yeah, it wasn't in the history books until Sir Walter Raleigh or whoever.
Right. It really, with the rise of cigarette smoking, lung cancer really took off in the 20th century.
Well, maybe we can reverse that, hopefully.
Absolutely.
But we don't want to put you out of work, but you'll find something else to
We'll
do,
find
I'm sure.
something else to do.
Absolutely.
I should also mention, most insurance companies right now are not covering the lung cancer screening. It's a fairly new test. The insurance companies are still looking at it. Patients should know that we are charging $199
Which
for
is
the
pretty
scans.
reasonable when it comes to what you're getting, right?
Yeah, well, if you figure in the cost of smoking for a month,
Always goes back to smoking, doesn't it?
It does.
Dr. John Fantauzzi, he's a board certified radiologist. He knows exactly what he's talking about, and we're hoping that you'll quit smoking if you smoke. And if you think you may have a risk, you might want to give them a call or talk to your primary care physician. Thank you so much for being
Thank
here.
you.
It's been a pleasure
Appreciate
meeting
it.
you today. We're going to take a quick break.